what about those supplements? Well, Karen Howard, the Executive Director of Organic and Natural Health Association, says that she has some facts we need to know as consumers before we buy those supplements at the convenience stores or online or anywhere that's just easy to find them. Good to have you with us, Karen.
Thank you.
So what is it that we need to know about supplements and buying? What should we be looking for when we buy supplements?
First of all, everyone should know that dietary supplements are regulated by the FDA, but they're regulated as food and not drugs. So it's a little different. So you can't make bad claims. You can't say you're treating or curing a disease. They're all supposed to have really great labels that tell you what's in there. So you want to look for those
Okay,
things.
so when you say the term gas station supplements, what do you mean?
I mean, anywhere you go in where it's a convenience store, some of these gas stations are as big as convenience stores now, or frankly, the largest gas station for supplements is really Amazon.
Oh.
So you have to be careful.
Okay. What are we looking for when we're reading labels? Are there certain words, certain red flags?
There are red flags. If it does make a claim, like it does treat or cure a disease, you want to stay as far away from that as possible. If it says something like approved by the FDA, no. But FDA doesn't approve these products, so don't do that either. And if it doesn't have the basic information, like the name of the company and a contact number, that's a little sketchy as well.
All right. Well, you've brought some supplements here. Tell us what you have.
I have 3 things that you kind of start the year off looking for. One is weight loss products. Everybody's dying to lose weight.
Oh, they're hot.
So these just don't work. The FDA and the FTC has done a lot of posting of information online about the ingredients in these products. If it says you can shed weight while you sleep or lose 5 pounds in 5 days, it's not true. Oh. So really, you're just going to have to continue to watch what you eat and exercise. So stay away from those.
No weight loss products.
No weight loss products like that.
What else do we have?
So this is the hot little number of the day. This is the hemp with CBD in it. So the interesting thing about this is, like, if you bought this on Amazon now, don't, because what you think it has in it, it does not. When you're looking for a CBD or a hemp product that will reduce pain, make you less stressful, or improve your sleep, you have to go to a reputable company and really do your homework and look for a certificate of analysis on that website to see what's in it.
Wow. Does it matter whether it comes in oil or if it's some kind of lotion you might rub into your skin? Or
3 different ways typically. The topicals, which are really fairly unregulated by the government. This oil is very popular and also comes in a capsule.
Okay. Now, what about for the sports enthusiast? Performance supplements. Do they work?
They do in some ways. So they've had a lot of research in very small groups. So young men who are very fit, usually in one sport. No way for me to know that that's going to work for you or me or for a teen who may want to pick this up. The other thing you have to be really careful with, these things can interact with your pharmaceutical medication, so you have to be very careful.
And are there ingredients in these that you should be very wary about? I mean, what about like testosterone, hormone kinds of things?
So they have been known to be polluted before with actual pharmaceutical products. And this one that I happen to pick up has this word creatine on it that's famous for being in these products and really doesn't have that much research to document its effectiveness.
So be careful with your sports
supplements.
supplements.
Also a lot of caffeine in these products.
All right. Now, you've brought some products that you say are good to buy?
The trifecta, I call it.
What are these?
Vitamin D, omega-3, and magnesium. 3 really good, solid products to take.
Tell us about each.
So vitamin D, you cannot eat your way to a healthy vitamin D level, and at least in the metropolitan area, we certainly can't live a lifestyle to get it through your skin. So you do need to take a good supplement. I take 10,000 IUs during the winter because I'm fainting off the cold and flu season.
Wow, and usually it says like the recommended daily allowance on those is about 2,000, right?
Oh, most of this, they come in all different sizes, and the government says like 400 IUs a day, which is really
low.
Yeah, your levels need to be between 40 and 60 nanograms per milliliter.
All right. Now, do you have to take this vitamin D with anything, and in conjunction?
Not necessarily.
With
I think that if you take vitamin D with C and magnesium, that you're really doing good for the cold and flu season.
All right. So what does magnesium do for us?
So magnesium is a great product. It really will help you with your sleep. It's great for a muscle recovery if you suffer from cramps after your workout, and it's important for heart health. All of us are deficient in all 3 of these products. Magnesium is one of them. So that one is a really good one to take too, and it comes in lots of different kinds of mechanisms, different types, so you have to kind of watch what you're doing there.
And what's our last one over here?
So this one is the omega-3.
Okay.
So you can get omega-3 from cold water fatty fish. A lot of us don't like that very much, or it's expensive and we don't want to spend the money. So a supplement's a great way to get it. Again, 80 to 90% of us are deficient, and it can come in the form of krill oil, which is what this one is, or basically cod liver oil or fish oil.
All right. Are we taking too many supplements, you think, that don't do anything, as opposed to taking few that that we should really concentrate on?
I think that's probably part of it. 95% of us take dietary supplements. One of the reasons that this happens for people taking things that they don't know if they work is that you don't know your levels. So knowing your level and being a part of this nationwide study, 16,000 people, and you can learn more about that at nutrientpower.org. You can actually test your levels for magnesium and vitamin D and omega, and you can measure it over time so you can see if your products are working.
All right. Karen Howard with the Organic and Natural Health Association, thanks so much for joining us today with some really good information.